Hello, students. My name is Dr. Dina Kentigan, and this lecture is on sleep. The objectives for this lecture are that you will be able to describe the physiology of sleep, you will be able to list the health effects of sleep deprivation, and you will be able to explain and implement sleep hygiene. In this section, we're going to discuss sleep physiology, circadian rhythms, the flow of consciousness through sleep, dreams, and waking is primarily structured by a 24-hour circadian rhythm, which result from an interaction, a dance between living things, and the environment. Circadian rhythms are maintained by an internal clock, which adjusts daily to environment cues, specifically light-dark cycles, ambient temperature, and social signals. In addition to compromising our exposure to healthy rhythms of light and darkness, denaturization and industrialization have dampened our exposure to dusk and dawn, to twilight, is a natural bridge between sleep and waking states of consciousness. The extensive use of electronic devices at night has further exacerbated our disentrainment from nature's circadian modulating forces for both adolescents and adults. Above and beyond the critical role in sleep, circadian factors also impact gut health, immune function, cardiovascular, and mental health. Melatonin. Our sleep phase, that period during which we are inclined to sleep at night, is structured by exposure to morning light and evening darkness. Dim light and darkness trigger the production of melatonin, which supervises the night shift of our physiology. In addition to regulating circadian rhythms and serving as a potent antioxidant, melatonin encourages the body to cool down by dilating distal blood vessels. Much like the world around us, we experience a gradual 1 to 2 degree drop in core body temperature through the night. Sleep is considered cool. Shifting from alertness to sleep. Sleep and wakefulness are also shaped by internal homeostatic drive, the rise and fall of alertness and sleepiness in response to physical activity, the duration of prior wakefulness, health and illness, and other physiological factors. Sleep involves withdrawal from the sensory stimulation of the waking world. We shut our visual, auditory, and other forms of sensory input. Olfaction, however, can remain active through sleep, lending itself to the use of aromatherapy. In deep sleep, brain activity, cardiovascular function, respiration, and other physiological processes slow significantly. Energy is diverted from normal waking physiology and redirected to rejuvenation, restoration, and immune activity. Sleep is also important for the brain to cleanse its waste. Although the night shift of our biology remains active compared to waking, sleep is unquestionably a state of rest and restoration. REM sleep. Although there's evidence for more subtle dreaming, meditation in all stages of sleep, we experience our most vivid dreams in REM sleep. Presumably to inhibit acting out our dream narratives, our voluntary muscles go offline at this time. If we waken during this REM atonia, we will experience sleep paralysis, usually a brief but frightening period of feeling paralyzed. REM sleep is associated with information processing, memory consolidation, and the downregulation of negative emotions. Dysfunctional patterns of REM sleep are correlated with mood disorders and dementia. Although classified as sleep, REM sleep is actually a distinct form of consciousness in which brain activity is similar to waking, but awareness is radically transformed. Sleep length recommendations. Normal patterns of sleep type, duration, and timing vary across the lifespan from infancy to late life. Infants, children, and adolescents generally require more sleep than adults, while older adults generally sleep less than younger ones. Sleep length recommendations for newborns, and newborns are classified as 0 to 3 months. The sleep range is 14 to 17 hours each day. For infants, who are considered 4 to 11 months of age, the sleep range is widened 2 hours to 12 to 15 hours each day. Toddlers, considered to be 1 to 2 years, the sleep range is widened by 1 more hour to 11 to 14 hours. Preschoolers, age range 3 to 5, the sleep range is 10 to 13 hours. And school-age children, ages 6 through 13, their sleep recommendation is 9 to 11 hours. The sleep range for teenagers ages 14 to 17 is 8 to 10 hours per night. For younger adults, ages 18 to 25, the sleep range recommendation is 7 to 9 hours. Adults, ages 26 to 64, the sleep range is 7 to 9 hours. Older adults, ages 65 and up, the sleep range is 7 to 8 hours. Changes occur with advancing age. About half of elderly people have insomnia. Additionally, sleep changes that occur with advancing age include increased awakenings and arousals, decreased REM or dream sleep, decreased deep sleep, essentially absent by the age of 50 in men, fewer sleep cycles, more time awake in bed. As important as obtaining sufficient sleep is, a number of studies have found that too much sleep could be associated with cognitive decline and increased mortality. Sleep disturbances. Pregnancy. Hormonal changes associated with menses, pregnancy, lactation, and perimenopause are linked to greater disruptions of sleep. Sleep disturbances are often considered a common discomfort of pregnancy. Recent studies show an association between sleep disorders and adverse pregnancy outcomes, including preeclampsia, elevated serum glucose, depression, prolonged labor, and cesarean birth. 3 common sleep disorders during pregnancy are breathing-related sleep disorders, for example, snoring and obstructive sleep apnea, restless leg syndrome, and insomnia. This underlies the importance of screening for sleep disorders and treating them during pregnancy to decrease adverse outcomes for mother and baby. Menopause. Variable poor sleep is among the most common symptoms reported throughout the menopausal transition. Sleep disturbances during the menopause transition are often related to hot flashes and night sweats. Women with these symptoms report difficulty falling asleep and staying asleep, in addition to early morning awakening. Infants. Infants can disrupt sleep, particularly for women who breastfeed their babies. Increased co-sleeping of mothers and babies have been a controversial issue, with some arguing that, in addition to disrupting mother's sleep, increases the risk of SIDS, known as sudden infant death syndrome. Proponents of solo sleep also point out that babies have more consolidated sleep when they sleep alone. Broader cross-cultural perspectives suggest that maternal-child co-sleeping, which does not necessarily involve sharing a bed, is actually protective against SIDS, and that lighter, less consolidated sleep may be healthier at this age of development. Solo sleep. In contrast to many indigenous cultures, sleep is typically viewed as a strictly individual experience in our world. Children are frequently ushered into solo sleep at an early age. Possibly as a result, there is a strong trend among married adults to sleep apart, despite the fact that this is linked to decreased marital satisfaction. Proponents of family bed view sleep as a social experience and allow children to make their own decisions regarding solo or social sleep. Could it be that early solo sleep leaves one overly sensitive to the presence of others sharing a bedroom? Sleep problems. Insomnia. Sleep disorders, which are among the most prevalent health challenges we face today, are associated with immeasurable human suffering as well as extraordinary economic burdens. Insomnia is the most common sleep disorder, while obstructive sleep apnea, OSA, presents the most immediate threat to health. Survey data collected from the Centers for Disease Control and Prevention and the Maternal and Child Health Bureau revealed many Americans regularly fail to obtain sufficient sleep. 34.1% of children fail to obtain sufficient sleep. 74.6% of high school students fail to obtain sufficient sleep. And 32.5% of adults fail to obtain sufficient sleep. Whether defined as a symptom or disorder, insomnia is endemic. Meta-analysis studies suggest that 10 to 13% of adults experience chronic insomnia. Additionally, 30 to 48% of older people struggle with insomnia. The lifetime risk of insomnia for women is as much as 40% higher than it is for men. Emerging evidence suggests that blacks have greater struggles with sleep than whites. Not surprisingly, poor sleep is also associated with poverty. Insomnia clearly impairs the quality of life. Sleep problems. Obstructive sleep apnea. You may see this abbreviated as OSA. Estimates suggest that nearly 1 billion people worldwide have sleep apnea. In the United States, the prevalence of obstructive sleep apnea is about 22% in men and 17% in women. Relying on a stricter definition of obstructive sleep apnea, the disorder impacts 2 to 9% of adults in the United States. Despite the prevalence of sleep disorders, the majority of these patients remain undiagnosed and untreated. This may be due to culture-wide resignation or normalization of sleepiness, alongside the common tendency to mask symptoms with sleeping pills and other substances. Health effects of sleep disorders. On the next couple slides, we're going to talk about some health conditions that can occur as a result of insufficient sleep. Chronic inflammation. Sufficient quality and quantity of sleep is essential for health and well-being in children, adolescents, and adults. Healthy sleep patterns support healthy immune function, while disrupted sleep has been strongly linked to chronic inflammation. Sleep research has clearly defined the role of inflammation in the chronic disease process and the role inflammatory markers play in accelerating cardiovascular and metabolic disease. However, what is not mentioned often enough is the role of sleep in decreasing inflammatory markers like C-reactive protein and tumor necrosis factor alpha. Studies have shown that sleep deprivation can cause elevated levels of these inflammatory markers, which have a strong association with obesity, heart disease, and diabetes. Diabetes. Numerous studies have described the link between sleep and diabetes. A meta-analysis and other large national cohort studies consistently showed that short sleepers are 28% more likely to develop type 2 diabetes and have greater mean levels of insulin, 2-hour glucose, and hemoglobin A1C levels. Obesity. Numerous studies have shown that both delayed circadian rhythm and sleep restriction are associated with obesity. One such study in the United Kingdom reported that chronic participant sleep deprivation and insufficient sleep were 72% more likely to be obese. It has been explained in numerous studies that the hunger hormone ghrelin is elevated in sleep deprivation, while the satiety hormone leptin is diminished. Heart disease. There are a number of studies that have shown that insomnia and short sleep increase risk of cardiovascular disease by 45%, incidence of myocardial infarction by 41%, and the incidence of coronary heart disease by 55%. Accidents and injuries. Obtaining sufficient quantity and quality of sleep reduces the risk of sleep and fatigue, related accidents and injuries in the workplace accidents and on the road. Just as a personal side note, for 10 years in the past, I suffered from insomnia. I had insomnia from like age 40 to about 50. And I fell a lot when I was running. I would be more likely to trip over the sidewalk. And one time, I almost went through a stoplight at a major intersection during rush hour, and so that is when I decided I needed to get some sleep aids so that I could sleep better, because I did not want to get in a car accident. Health effects of sleep orders continued. Mental health. More specifically, sleep is a critical factor in cardiovascular and metabolic health, as well as in mental health, positive mood, and cognitive function. In other words, you need sleep, especially if you're a student, so that your brain can function properly. Sleep and immunity appear to have a complex bidirectional relationship. Poor sleep erodes mental health, dramatically increases the risk of mood disorders. Chronic sleep loss and abnormalities are risk factors for major depressive disorders and bipolar disorders. In general, disrupted sleep is understood to be a key symptom of mental disturbances. In fact, a year of insomnia is the strongest predictive factor for major depression. Delayed sleep phase has been shown to increase the odds of depression by 4.31 times. Some studies suggest that African Americans are twice as likely to have sleep phase issues. Children who snore are 2 to 3 times more likely to demonstrate behaviors of hyperactivity, attention deficit, and aggressiveness than children who do not snore. Also, one study found that snoring in children predicted hyperactivity by 4 years. REM, or dream loss. Because REM sleep and dreaming are usually subsumed under the rubric of sleep, their specific impact on health and illness has been somewhat obscured. Emerging findings, however, suggest that REM, dream loss, may be associated with memory deficits, dementia, and, as we already discussed, depression. Mortality rate. Chronic insufficient sleep has been linked to an increased risk of mortality associated with cardiovascular disease, diabetes, obesity, and cancer. More specifically, the estimated mortality rate for those having a sleep disorder is 9.3% compared to 5.2% for those without a sleep disorder. Even after adjusting for age, sex, BMI, coronary artery disease, stroke, and emphysema, having a sleep disorder remains a significant predictor of increased mortality. Obstructive sleep apnea. Sleep apnea and other sleep disorders can have a profound impact on relationships and bed partners. Oftentimes, the wife or husband of a patient with sleep apnea will complain that their spouse is not breathing at night and kicks or snores so loud that they cannot sleep. This can lead to sleep deprivation and mood disturbances. The strain can become so intense that it can cause couples to become sleep separated into separate bedrooms. This has a profound impact on the intimacy of the relationship and increases risk for divorce. Additionally, sleep is particularly vital to sexual health for men. Studies have shown that men with sleep apnea have lower libido and testosterone levels. However, these low levels have shown improvement with treatment of obstructive sleep apnea. In the early decades of sleep medicine, the nocturnal penile test was used to determine when a patient was in REM sleep, as a circulation increases to the penis during REM. Normally, a healthy man should have about 3 to 4 nocturnal erections per 8 hours of sleep. Many men older than 40 years of age report no longer experiencing such erections. This lack of blood flow is associated with a lack of REM sleep. This is consistent with sleep apnea being most severe in REM sleep, resulting in extremely fragmented episodes of REM or the absence of REM sleep altogether. I have had numerous patients tell me that on the first night they used a CPAP, they woke up with a very stiff erection and haven't had such an erection in many years. Similarly, male patients of mine have reported improvement in erectile function with treatment of sleep apnea and improved sleep. Additionally, severe obstructive sleep apnea has been shown to have a dose-response relationship with hypertension, myocardial infarction, heart arrhythmias, and stroke. Approximately 71% of patients with resistant hypertension have obstructive sleep apnea. In the Wisconsin Sleep Cohort Study, those with severe obstructive sleep apnea were 2.6 times more likely to have a myocardial infarction, congestive heart failure, and cardiovascular death compared to those without severe obstructive sleep apnea. An observational study has shown that patients with obstructive sleep apnea were almost twice as likely to have a stroke compared to those without obstructive sleep apnea. The Sleep Heart Health Study found that participants with severe obstructive sleep apnea were 4 times more likely to have arterial fibrillation, 3 times more likely to have non-sustained ventricular tachycardia, and almost twice as likely to have complex ventricular ectopathy than those without severe obstructive sleep apnea. Pain. There is a strong bidirectional relationship between sleep and pain. Longitudinal studies have shown that participants with insomnia and short sleep duration predict the onset of chronic musculoskeletal pain by 6 years, suggesting that short sleep and insomnia are risk factors for chronic pain, and this relationship is partially mediated by depression. A similar relationship has been found between fibromyalgia and insomnia. One study deprived a group of healthy middle-aged women of delta sleep for a period of 3 days and found a significant decrease in pain tolerance and increase of symptoms of fibromyalgia. More human factors affecting sleep. Many human factors, such as stress, influence healthy sleep. Other behaviors, such as eating a large meal, consuming stimulants like caffeine or alcohol, exposure to light at night, or exercising too close to bedtime can alter sleep. Sleep affects mood, cognitive performance, impacts work performance, productivity, and workplace social interactions. Getting a good night's sleep is important for stress reduction, better health, and optimal performance, as well as reducing daytime fatigue. Complementary approaches for sleep. Complementary approaches can be classified by their primary therapeutic input, which means how the therapy is taken in or delivered, which may be nutritional, psychological, physical, or combinations of the aforementioned. Let's talk about nutritional approach. Certain foods may affect sleep. Preservatives, such as sulfites and MSG, can negatively affect sleep. Conversely, other foods may make one sleepy, such as a high carbohydrate diet or foods that contain the amino acid tryptophan. Think about the last time you had a big pasta meal or the last time you had a big Thanksgiving meal. Weren't you quite sleepy afterwards? The body cannot produce tryptophan. It must be obtained from food. 1 gram or more of tryptophan has been found to increase sleepiness and decrease the time it takes to fall asleep. Foods that contain tryptophan include eggs, milk, low-fat yogurt, cheese, nuts, seeds, seafood, and poultry. In addition, spinach, broccoli, asparagus, kiwi, apples, bananas, avocado, beans, grains, and oats also contain tryptophan. Dietary supplements such as melatonin are also effective to help one get to sleep. Be sure to use scientific evidence when it comes to dosing of supplements. Doses of 3 milligrams of melatonin are effective for sleep. More is not always better. Herbs. Passion flower, California poppy, and ashwagandha are just some examples of herbs that have been found to improve sleep. As you can see here, the dosages for passion flower to help make one sleepy are 400 to 1,000 milligrams twice a day. And this can be put in hot tea and steep in hot tea. California poppy, the recommended dosage to help promote sleep is 40 milligrams twice a day. California poppy is available in tablets, teas, or tinctures. Ashwagandha root, 400 to 500 milligrams twice a day, is also available in tinctures, capsules, and teas. I have ashwagandha tea bags, and I try to have one of those. Actually, I just bought it last week, and I try to have one of those every night before to go to bed, and I will say it does help relax me. Now let's talk about some psychological approaches to a better night's sleep. Meditation, even if done for only 10 minutes a day, positively impacts sleep. There are many apps available on smartphones or videos on YouTube that are free for consumer use. And on a personal note, I started meditating, about 4 years ago. And wow, what a difference that makes with my sleep. And I started for 5 minutes a day, but in doing research on meditation, I found that really 10 minutes was the sweet spot, and I can say that really does help me sleep better. Hypnosis. Because hypnosis encourages relaxation and reorients thoughts and emotions, it may be a useful tool for sleep. Music. Music can facilitate falling asleep and sleeping longer. In studies, slow music or classical music is more relaxing. Classical music or instrumental music can slow the pulse and decrease levels of stress hormones. Relaxation exercises, such as box breathing, promotes better sleep. To box breathe, breathe in for the count of 4, then hold your breath for the count of 4, exhale for the count of 4, and then hold your breath for the count of 4. I actually practice box breathing if I wake up in the middle of the night and I have trouble going back to sleep. I will do the box breathing, and I probably never get to like the number 5 as far as times doing it. I might do the box breathing for 3 repetitions, and then I'm usually back to sleep. Now we're going to talk about some physical approaches to a better night's sleep. Room temperature. The best room temperature for sleep is between 60 and 70 degrees. Some studies even have a more specific room temperature at 65 degrees. A cooler temperature is the ideal environment to fall asleep and remain asleep throughout the night. Think about a time in the summer when maybe your AC wasn't working, or maybe you went to a hotel and you could not control the room temperature. Think about your sleep. Did you really sleep well that night? Exercise. Studies indicate that moderate intensity cardio is better for sleep health. This includes activities such as swimming, biking, jogging, or walking. Resistance exercises help to decrease anxiety and depression, which can hinder sleep. You should not exercise right before bed. Ending exercise sessions at least 2 hours before bedtime is ideal. In a study, acupuncture was superior to medication, especially combined with herbs. Swedish massage is known for relaxation benefits and is best for sleep. Spinal manipulation, otherwise known as the chiropractor, has been found to help the body function more efficiently, including helping our bodies to relax and fall asleep. Some approaches to sleep actually combine nutritional or psychological or physical approaches. For example, yoga. Yoga involves meditation, which is psychological, but it's also a physical activity. Tai Chi, Qigong, these also involve multiple approaches, and they can be used to help one get a better sleep. Art therapy is another one because that's physical, but yet you're also using some psychological approaches there. So a lot of these classes that are on the slide are offered for free on YouTube. Getting a good night's sleep, as you have learned, is so important. And there's some things that you can do every night to help promote a better sleep. And this term is called sleep hygiene. Some tips that you can do to promote sleep hygiene include stop pre-sleep electronic use 30 minutes before bedtime. Electronics are cognitively engaging and can unexpectedly induce emotions such as stress from an email or excitement from a story, and these can prevent you from winding down. The bright light from electronics also disrupts a normal sleep-wake schedule by conflicting with nature's daily light-dark cycle. Don't answer emails, peruse social media, or watch TV or movies. One should use bed for only sleep, sex, and sickness. Spending less time in bed can promote more continuous and deeper sleep because your body begins to associate the bed with rest. Don't eat, work, or watch TV in bed. Naps. Regular naps may deter nighttime sleep. If you really need to nap, do so before 3 p.m. Consistent bed and wake times promotes a regular sleep schedule. Even if it means keep the sleep schedule during the weekend, your sleep will improve in the long run. Avoid alcohol and caffeine 4 to 6 hours before bedtime. Caffeine and other stimulants, such as medication and drinks, activate neurobiological systems that maintain wakefulness. Alcohol requires metabolism, and this physiological arousal can fragment sleep despite seeming to induce sleepiness initially. Relaxing behaviors. Relaxing activities can promote, I'm just having trouble. Let's start this again. Relaxing behaviors. Relaxing activities can promote sleepiness by reducing physiological arousal and minimize thinking. Conversely, work or planning activities at bedtime can delay sleep, so avoid them right before bed. Some relaxing behaviors include stretching, calm music, slow breathing, and a warm shower or bath. Worry list. Falling asleep is harder if you are worrying or thinking about emotional things. So set aside a few minutes before bed and list everything that you want to remember for tomorrow, including worries themselves. Also, put a pen and paper by your bed. If you awaken during the night with a thought, idea, or task that you are afraid you will forget, write it down so it will not keep you up the rest of the night. Boring activities. Boring activities right before bed may help your cognitive processes to slow down to promote sleepiness. Some suggestions include listening to a podcast in a language you don't understand, read an old textbook of a subject you don't enjoy, or read a book from a genre that you don't like. I hope that you don't use any of my lectures for your boring activities. These are the references that were used to create this lecture. And once again, thanks for listening.